When we talk about the HPV-related cancers, those are primarily in the oropharynx, which is the tongue base and the tonsil, but the traditional cancers typically can also involve the tongue, the lips, the floor of the mouth, the jaw, the gums, and the hard palate. And the pharynx, that includes the nasopharynx behind the nose. We've addressed the oropharynx, but also the hypopharynx near the larynx. And in your case, laryngeal cancer that involves the larynx and the voice box and the epiglottis. So head and neck cancers can occur in any of those places. Can you talk about some of the signs and symptoms people can look out for in those areas?
Well, the important signs that are common to all cancers are having a sore throat, feeling that you cannot swallow or difficulty in swallowing. In advanced stages, it can interfere with breathing. If you have increase in lymph glands in the neck, and also feeling like a lump or something stuck in your mouth. Sometimes they have symptoms such as pain in the ear or pain in the throat. And then are specific cancers such as sinuses or lips. If there is an area of the mouth where there's red or ulcerating lesion in the oral pharynx, these things can indicate that there is a cancer risk.
Exactly. And can you talk about your initial presentation? What symptoms did you experience?
Well, I experienced something stuck in my mouth, and when it didn't go away after a week or so, I went to see my doctors, and they discovered it very, very early. And I was fortunate that it was possible to remove it by a simple biopsy. And unfortunately for me, even though I got radiation, the cancer came back about a year and a half later, and I required a laryngectomy to remove the cancer because it has moved to other places in the throat, and that was the way to treat it initially. But being vigilant and recognizing early that something wrong, something is happening, can definitely save many lives.
Exactly, and quality of life, right?
Right.
So what were some of the tests exactly that you underwent in trying to find this cancer and make a diagnosis?
Well, I got obviously the most important thing was to have a good otolaryngological examination with endoscopy, where they put a tube into your throat through the nose to try to detect and see what's going on. Direct examination. The other tests that I have were MRI and CT. But the most important thing in my case was a good physical examination, because in my case the MRI and CT didn't show anything wrong, because you need the cancer to be larger than about half an inch, and mine wasn't yet. So seeing your doctor is the most important thing a person can do to catch the cancer earlier.
Absolutely. And one of the things the Head and Neck Cancer Alliance does and promotes is free screenings throughout the country and throughout the world. And traditionally, the Head and Neck Cancer Alliance has done that during Oral Head and Neck Cancer Awareness Week that occurs in April every year. But there's been a push in the last couple of years to really spread that out throughout the year and help raise awareness to these signs and symptoms that you addressed, as well as direct patients to facilities that can provide a screening. And a screening is simple and easy, and it does involve a physical examination, feeling the neck, looking for signs and symptoms, and talking about signs and symptoms. So certainly if any listeners were to identify any of these risk factors that you addressed, such as a change in swallowing or change in voice or lump in the neck or or pain in the ear, difficulty breathing, then certainly looking to some of these screening sites or reaching out to your doctor is a good way to really find those cancers early and help minimize the intensity of the treatment that might result.
Absolutely.
Yeah. And in terms of staging head and neck cancers, one of the important pieces of that workup when you had the endoscopy and the scans is to come up with a stage, a TNM stage, for that head and neck cancer that really kind of directs the treatment. And part of that also is being evaluated by a multidisciplinary team. And I think that's really important in the management of head and neck cancer is that there are multiple specialists, including the otolaryngologist, who's often the first person to make the diagnosis, but a team of specialists, including a radiation oncologist and hematology, oncology, speech pathology, nutrition, social work, pathology. There are so many professionals involved. Was there a multidisciplinary team involved in your care?
Yeah, fortunately.